Good morning, and thank you, Chairman Lujan, for holding this hearing. As a resident of a rural state, I've long been a proponent of telehealth for the access it gives to rural communities. If you live in a major city, you usually don't have to think too much about where you'll find a doctor if you need one, but that's not always the case for Americans in rural areas. In the smallest towns in America, access to specialty care can be a challenge. The only providers may be primary care providers, nurses, pharmacists. These providers are essential to rural families, and there are times when specialty care is needed. And when there isn't a specialist close by, telehealth can help get patients to the medical care they need from a remote location through the use of technology. Telehealth services are also critical in nursing home facilities. In my state, we have strong programs designed to bring on-demand support into facilities to help avoid unnecessary emergency department transfers. By reducing unnecessary senior hospitalizations, my Reducing Unnecessary Senior Hospitalizations Act, or the RUSH Act, would help facilitate more arrangements like we have in South Dakota, allowing medical groups to collaborate with nursing homes to provide telehealth services through a Medicare alternative payment model. I'm also pleased to support the bipartisan Connect for Health Act, which aims to expand telehealth services through Medicare and is supported by more than half of the United States Senate. The Bipartisan CARES Act played an important role in further expanding access to telehealth throughout the COVID-19 pandemic, and I look forward to continuing the conversation with my colleagues at the Senate Finance Committee on the path forward for Medicare reimbursement post-pandemic. And in my role on this committee, I will continue to advocate for the expansion of broadband services, which has allowed more patients in rural areas to take advantage of telehealth services. It is critical that any additional broadband funding goes to truly unserved areas so we can expand the reach of next-generation services like telehealth. The Federal Communications Commission plays an important role to help expand telehealth services through a number of programs. Congress, acting in a bipartisan manner, provided a significant amount of funding for the FCC's COVID-19 telehealth program through the CARES Act and the year-end coronavirus relief package. Several healthcare providers in all 50 states have been able to participate in this important program. In my home state, there are a number of excellent healthcare providers expanding access to telehealth services by participating in this program. The Community Healthcare Association of the Dakotas received funding for equipment necessary to expand remote patient monitoring and other telehealth services in community health centers. Sanford Health was able to utilize funding to secure wireless access points, which is necessary to conduct confidential telehealth appointments. And Avera Health and its affiliated Aval eCare, represented on this panel today, received funding for a number of services, including remote monitoring equipment and software to provide care for chronically ill patients in their homes. In addition to the FCC's COVID-19 telehealth program, the FCC's Universal Service Fund provides support for the Rural Health Care Program and for the Connected Care Pilot Program, which was spearheaded by Commissioner Carr. I appreciate Commissioner Carr taking the time to speak with us today about these programs. It's my hope that we will see you again soon before this committee, as there are many other important issues at the FCC of interest to members here. And lastly, I'd like to extend my thanks to Ms. Deanna Larson, who's president of Aval eCare, for joining us today. As president of Aval eCare, Ms. Larson has helped advance telehealth services across many areas in the Midwest. Thank you to all of the witnesses for being here today, and I look forward to hearing from you. Thank you, Mr. Chairman. Ms. Larson, how did the FCC's COVID-19 telehealth program help expand the reach of Aval eCare, and I used to know it as Avera eCare, but Aval eCare telehealth services, and is there anything that we should know as policymakers about the program? What worked well and what didn't?
We used the funds to create another situation of telehealth in more emergency settings, more skilled nursing facilities, and specifically in that home setting. So the funding really worked very well for us. Some of the things that worked very well and were difficult at the same time, it was very quick notice. You know, it seemed like we had to be first in line, and so we applied within 24 hours, which is no small feat when you're trying to collect all of those tools. But nonetheless, we were very happy to apply. I think that worked very well. We were able to get equipment out, and we were actually able to get equipment out quickly. The reimbursement for that equipment took nearly 12 months. So due to the paperwork and processes that are in place, and again, it wasn't, you know, it could have been part of our issue too, but that is part of how do we streamline that so that we aren't using extra time to try to make those things work very efficiently. I do believe it was a great program, and it funded what we needed to have to extend our programs. We did not apply for the second one, not sure. Remember, there was a lot of unknowns during that time. Not sure when funding the reimbursement would be coming, and then again, the notice to get ready so quickly. But we deeply appreciated it, and we're able to impact hundreds and hundreds of lives through the funding we received.
Well, it seems like we ought to be able to improve on a 12-month reimbursement rate, even for organizations as inefficient as the federal government. Commissioner Carr, could you talk about some of the lessons learned from the COVID-19 telehealth program and what other initiatives are underway at the FCC to support telehealth services?
Well, I think one of the most interesting lessons learned is how much uptake there was for these services. We talked about the 75-fold increase depending on the facility. People found this very easy to use, preferable to use, health outcomes improved. So we do need to move down this path, and I think finishing the award of funds from our existing programs would help, and looking at how do we sustain this from a payment perspective long-term are some important steps we need to take.
Tell me about, we know telehealth services have dramatically expanded with the improvement of broadband services in rural America. You all have testified to that. What steps has the FCC taken to expand reliable and affordable broadband services to unserved areas, and what needs to be done to make sure all of the broadband funding provided by Congress goes to truly unserved areas?
Well, there's a lot of steps we took over the last couple of years to streamline infrastructure rules. A lot of it was looking at some of the legislation that you all have been working on. We pushed a lot of spectrum out, building off of the Mobile Now bill that you all introduced. And going forward, we need more of the same. One, we need to continue to streamline infrastructure rules. Two, we need to continue to get spectrum out there. I've put a spectrum calendar out that would make sure we do that. And importantly, we have a lot of funding right now in the pipeline that we need to get out the door, whether it's RDOF Phase 1, which we only have a couple percentage points of the total award moved out the door yet. So we have funding in the pipeline that we need to get going, because as I did a visit with Senator Wicker, there's broadband builders that won funding that are ready to go. They're just waiting on those dollars to get to them.
And what does it take to get that going faster?
Well, I'm not sure. We're behind schedule in terms of the CAF2, which is an analogous program,
right,
in terms of the percentage of funds that we got out the door. So we got to keep moving on that. Obviously, long-term, the maps are going to be key. We got to complete those maps. That's what's going to let us go to RDOF Phase 2, 5G fund, and get more support for broadband builders in rural communities.
Okay. It always comes back to the maps, doesn't it? I've been working on maps for a long time. Ms. Larson, how have you seen expanded broadband services improve patients' and healthcare providers' experience in areas that have lacked sufficient healthcare services, particularly specialty care services? Can you talk about that?
You know, I think a great example of this is the care and services, especially through the opportunity with the COVID relief pieces. We were able to provide in two of the IHS areas, both the Billings area and the Great Plains area. Previously, you know, there hadn't been enough access for us to provide care, and having broadband available. The last one was in the Billings area. We were actually able to reach another tribe location and a service unit area. We increased, through the relief, we were able to increase the behavioral health services response. So able to provide care in the home through behavioral health versus having to go to a clinic. The no-show rate of those individuals reduced by up to 40%. So now we're reaching 40% more of the individuals coming on a telehealth visit receiving behavioral health services. So, you know, the availability of that in the home setting, and because broadband was now brought out there, they could actually use their phones in their home situation to have behavioral health services. Huge extension, and the clinicians in the behavioral health arena specifically are very comfortable on video or on phone. I mean, we have many physicians in many specialty areas that are comfortable at this point, but it's especially interesting that individuals with behavioral health needs are more comfortable in a location, not always in a clinic setting, maybe in their home setting. Also, the providers in behavioral health are telling us they can learn more. The patients are more comfortable in their home setting. They also can see the environments behind them or around them to help them understand maybe what's happening with the individual, which is not something you can get if the individual comes in and is not able to really communicate easily in the clinic setting. So taking broadband out across the reservation areas has enabled physicians, I've mentioned behavioral health, there's also dermatology, there's endocrinology. We know the situation with diabetes in that population, able to manage and control that with individuals not always in the clinic setting, but making broadband available in that setting also gives our specialists the ability to be in the clinic and work remotely with those clinic physicians.
Thank you. Thank you, Mr. Chairman.
Thank you so much, Mr. Thune.